guys, welcome to the first episode of Physiology Phreaks. Two physiologies,
one freak.
I'm Kristi.
I'm Parker, and today we're going to be going over a couple different articles and journals and discussing them, and then talking about physiology as a whole and the way that we've been experiencing learning it in our own education and just the way that we see other people experiencing it and learning as well. I think our main focus today is, especially with the articles that we found, is about like women's health and the discrepancy between women getting medical care and men getting medical care, because there is such a difference, and it's honestly shocking and kind of insane.
And not always in medical care, but even in research. A lot of research, they only did clinical trials on men for like mostly everything. And that is like really, really bad.
Yeah. And then it's like, why are all these women having different side effects that we weren't expecting? Oh, it's because you didn't test it on women, which actually leads very nicely into the first article that I found. The title is Sex Inequalities in Medical Research, a systematic scoping review of the literature. And this is like just jam-packed full of information, just like kind of what we were saying. It came out, it's from 2022, it's super recent, and we'll link anything that we talk about in the description, so if you want to read it yourself, you absolutely can, and you should. But really, they went through a bunch of different research projects, a bunch of different literature reviews, and, you know, all of these different trials, methods are in there, so if you want to know better than what I just said, they're in there. But they really found that there is a gender gap in medical research, and not in every study, not in every case, but it is often enough that it is significant. They found that female representation, just in general, was only about 37% across 86 randomized controlled trials.
Wait. 37%? Across 86 control trials? Wow. That's crazy.
Yeah. So, I mean, like, less than 50% is insane at all. Like, just underrepresentation. And they talk so much about, like, the different risks that come with underrepresentation and, you know, all the stuff that comes with it. And there are so many good quotes, and it's hard for me to not just like read straight from this article because it's insane. But
honestly, go for it.
The one of the first ones that they talk about is myocardial infarction and acute myocardial
infarction.
Yeah.
Yeah.
Anyway, but they said they present with different symptoms to men and are less likely to be identified during.
God. Sorry, I was just talking about someone. Sorry.
No, tell me.
I was just talking about my friend Taylor with this. Because I was like, dude, I'm like recording a podcast with one of my friends for physiology. And I was like, if you have any physiology questions about like women, I don't know, anything, of that nature, I was like, let me know. And she was like, yeah, how a heart attack presents very differently in females. And she was like, it's a big issue.
Yeah.
But yeah, so it's very relevant. It's incredibly relevant.
Yeah, and I mean, they said 6 months after admission for MI, female patients, especially younger women, were more likely to suffer major adverse events and overall mortality.
That's crazy.
Right?
That's crazy.
It's insane. And it's like, how do you not want to know?
Yeah. Oh my god, okay, hold on, because this like really bothers me, because I feel like people aren't curious about anything anymore. They just want to like know, they just want to like memorize things just to memorize it, and you're not actually like curious about it. It's one thing to study for an exam and want to know the content on the exam, but like you should want to dig deeper. Your curiosity should be at the forefront of everything that you do. And for a lot of people it isn't. And I'm like, how sad must you be? Sorry. But like, how sad must your life be if you're not curious about all of this stuff?
Yeah.
Like, I don't know. It just makes me really sad.
Yeah, it's like, it is always, and you do notice too, like when you're taking a class that you're interested in, it's way easier to study. Well, not easier because the material's actually easier, but easier in the way that it's, when you care about it, it's easier to understand, you know?
Yeah.
And not always, sometimes, because like anatomy, I loved it so much, and it was still so hard.
Yeah.
You know, but I loved it. You know, it was so fun.
Cool. I really enjoyed the lab for that class.
Yes,
really
it was amazing.
I actually brought, I don't know why, I was like packed my bag, and I was like, you know what? I had all my old notes from Cadaver Lab, and I just put them in my bag. So it gives me
Just
to,
in
like,
case.
reference, like,
Just
a
in
major
case.
vein or
Yeah.
whatever, like, just, you know.
And that's something that, you know, because you're curious and because you like it, maybe I'll use it.
Yeah!
Maybe I'll keep it, maybe I'll use it, you know?
Yes.
It's not something that you
Yes,
can just
I
throw
have
away.
them on my fridge because I was really proud of them.
This
I
is
thought
true.
it was really
This is
relevant.
true.
So I'm, you know, grabbing my vegan chicken nuggets from the freezer, and it's like, you know, brachiocephalic whatever. And I'm like, hell yeah, dude, and it's sad because I'm forgetting, like, half of it already.
Yeah, I know, it
I
is,
try to review a little bit, but not really.
it's a difficult muscle to work out, but it's one that really does go away.
Yeah.
Which really sucks.
Yes. The only thing I remember from today was axillary lymph nodes. You do have lymph nodes in your armpits, dear listener. Yes, you. You have lymph nodes in your armpits, and you too. I know.
Anyway. Another thing in this article that I found was really, really fascinating was doctors and researchers were assessing attractiveness and aesthetics in women along with their medical diagnosis.
It's nauseating.
It is.
Attractiveness of women with rectovaginal endometriosis.
Oh, found it. Yeah.
And yeah, we're asked to evaluate the attractiveness of women undergoing surgery on a Likert scale. Physical examination of the woman included measurement of the breast to underbreast ratio.
What is the underbreast ratio? What does
I think
that
it's
mean?
like cup size.
Oh,
Like sagittal
yeah.
boob. And I was like, and this is like real. This is like a legit real study on like NCBI that you can look up.
Oh my god. Women with rectovaginal endometriosis were deemed by researchers to be more attractive than those with endometriosis of other locations. These women were also leaner, had larger breasts, and earlier, what is that? Coitarge?
Hold on.
What is that?
It's gonna be
But anyway,
insanely-
thank goodness we did that study. Like, how else would we have
that is
known?
something insane.
What is it? I can't read it.
First experience of sexual intercourse. Isn't that insane?
I can't.
Earlier, like, that's like, I'm just shocked how they got the funding for that, is what I'm really confused on. Like, you have to submit a proposal, and in the proposal they wrote, we want to examine the
Attractiveness
of women with rectovaginal endometriosis and their first, how do you even pronounce that? Coitarge?
I'm like so floored.
Okay, that's disgusting. Let's move on. Sorry.
Yeah.
That's gross.
No, I think that it's like. I'm just like speechless in the way that we, as a society, treat women in healthcare. Like the whining woman thing.
Oh, okay, so I was like, I was doom scrolling like a couple weeks ago.
As one does.
And I saw this video of this woman talking about she was a medical student intern, or maybe she was starting her residency, I don't know, like first year intern or first year resident at a hospital. She said she had this patient who was a middle-aged woman and presented with a whole laundry list of symptoms, but her primary concern was that she quote-unquote didn't feel like herself. And this resident didn't know what to do with her. All her labs were clean. Took it to her attending, and her attending said, oh, that's a WW. And she was like, what is that? And he goes, it's just a whining woman, but don't write that in the chart. And I did in fact find the article. This woman's name is Dr. Mary Claire Haver. And she said that she went to her chief resident, and he said, and he smirked and said, whiny woman, don't write that in the chart. But women at this age, they just tend to have a lot of somatic complaints. There's not much we can do. Pat her on the knee and tell her to drink some water and get more rest. He wasn't being cruel. He was being efficient, practical, passing down the shorthand of how to survive in a busy clinic. And I, green and obedient, absorbed it. I nodded, returned to the room, and finished the visit without offering her anything but vague reassurance. She left with no plan, no explanation, and no validation, and I've never forgotten her. I wish I could tell you that that moment sparked immediate rebellion in me. It didn't. I went on to see dozens more women like her. Midlife, complex, exhausted, symptomatic, and I filtered their experience through the lens I inherited. That unexplained symptoms meant more stress, not something physiological. that normal labs meant the patient was fine, and that midlife women were difficult, dramatic, and demanding.
Yeah, and it's what she said too. Like, I wish it had immediately sparked, rebellion in me, or but it is so easy to listen to someone who's in a higher position than you, that you think knows way more than you, who's been doing it longer than you, and go, oh, they're right.
Yeah.
Because then I'm not going to question the chief doctor, the chief surgeon, or whatever, or my professor, or my, whatever, my advisor, it's
whatever. Yeah, and I think that's something that I feel like I've seen some discourse on this. I don't know if this is 100% true, but if you work in the healthcare sector, if you're a physician of any kind, if you are a dentist, an optometrist, anything of that sort, people place their trust in you as a physician, and they trust that you have the necessary experience and the necessary critical thinking skills to hone that experience in correctly and accurately and appropriately to what you're presenting with. And I feel like, and that's hard. That's a lot of responsibility, and you have to take it seriously. I think there can be a lot of harm perpetuated if, both parties aren't in agreement, or maybe you're having a hard time describing what you're feeling, or if you're a physician that just doesn't know what the they're doing. And it's like, it is a hard job. It is supposed to be a hard job, and you are supposed to take it very, very seriously. And I think people, I don't know, I think in this example of this story, I feel like this doctor failed this woman, at least the chief resident. I mean, she was an intern, that's hard. Being an intern is hard. But I think it's systematic, really.
Yeah, absolutely. And I think that a lot of that, too, comes from, I can't pinpoint what it is in the blood work. I can't pinpoint exactly what it is in her blood pressure or her heart rate, and so sorry, there's nothing we can do, you know what I mean? Go talk to a psychologist, I guess. But there has to be something else we can do, because this same thing happened to me over the summer, and I don't know if we'll keep it in, but I was going because my menstrual cycle was going on for 3 months straight.
Oh my God.
And it's because I have birth control. Mm-hmm. And anytime you have birth control, they say, well, it's because you have birth control.
Yeah.
And I said, okay, but not only that, I'm feeling all these really debilitating symptoms. Mm-hmm. And she ran my blood work, and she looked through everything, and she was like, well, you're fine. I don't know what to tell you. And so I left with nothing. I was so nervous the whole time, but I was so excited to get some kind of closure, some kind of answer, some kind of medication, other than sorry, I don't know. And and my doctor was a woman. It's not like it was a misogyny thing, but it was just it was so disheartening. And I think that so many women experience that if you're having symptoms that aren't physically, or something that you can immediately see, not tangible, and but maybe it is, and we just don't know how to test for it yet, but there's not enough research going there. It was same with PCOS and endometriosis and all these things and birth control, where it's all these things that are so common, so prevalent, so, relevant to our society, and we don't research them as much. There's no funding. It's just not happening. And that's why so many women are walking out of doctor's offices with nothing, with no help. And that's not to say that every woman experiences that, or that every doctor will do that, or every woman's symptoms are undiagnosable. A lot of times it is, and you can get help. Everybody has gotten help for something, but it happens too often.
And so I saw an Instagram reel. One of my friends reposted this. She's in her first year of her PhD at Purdue in molecular biology, I think, or biochemistry, and she reposted this reel on her story. And it was a video of this woman saying, I would love to publish my research in the US, but half of the words in the thesis are banned. And the words, it was women, female, and it was like menstrual cycle, vaginal, and anything like that. And I was like, hold on, there's no way that's true. And anyways, so I just pulled up a list of banned words under this administration, and it is, in fact, pretty much everything. I don't even know where to start. It is, I literally don't even know where to start at all. Barriers, autism, biomethane, bisexual, fetus, hate speech, Hispanic, minority, migrant, mental health, methane emissions, marginalized, men, is banned, pronouns, queer, racism, safe drinking water, science-based, sex, science-based, bro. Where is it? Science-based. Vaccines, victims, traumatic, trivial, transgender military personnel. How is that banned? Hello? Sustainable construction.
Systemic.
Oh, yeah.
God forbid you say the word systemic.
Pregnant people, pregnant persons, privileges. Pyrolysis?
Race?
Guys, that just means fire burning. That just means like combustion reactioning is happening. What do they not want us to know about
We might be
pyrolysis? We are cooked!
And like, as far as I'm concerned, based on the knowledge that I haven't looked into this recently, but it's not like you absolutely cannot do research if you put these in your abstract or proposal, but it's like you are far less likely to get government funding. It is more likely to get flagged, or like you're like, oh, a person of interest. So it's not like saying these words like puts you on the naughty list forever, but it's like you can't. It's like I would do research on something else to avoid that.
Yes.
You know what I mean? Like, especially if I like really needed funding for something I need to do research. I want to do research. All I've ever wanted to do is research.
Yeah.
Not me personally, but like in general, like hypothetically. Why would I do something if I know that I'm going to have to jump through a million more hoops to research something that, you know, is...
that you're passionate about.
Yeah.
But though they have those... I don't know, like, there's just a lot more hoops you have to jump through, and they're a lot more difficult to jump through, and oftentimes they don't even let you jump through them. And so you're not fully free to discuss these things if you want to get research, like federal research funding.
Yeah.
From like NSF or NIH or whatever, and it's incredibly disheartening.
Yeah. But you know what you can do? Use AI for everything.
Oh my god. I don't know if I have it in me to talk about this right now. I'm gonna start crying.
But I don't know. There is this whole thing, like, you're just saying, like, you know, I want to research something that I'm passionate about, which in this society is what we need more of, in my opinion. Yeah. It's like, we are just overrun by apathy, you know?
Yes!
Yeah. And it kills me, and it's so easy to not care, and it's so easy to be like, I'm going to be a doctor because it's going to make me a lot of money and help people, I guess.
Yeah.
But to do these jobs, I think, like, you need to care a lot. And I think that's why med school is so hard. I mean, there's a lot of reasons, but you have to have the drive to want to do it, you know? And I think that people are driven by the wrong things sometimes, but you have to care. And, you know, it's so easy to not care about school either, because it's like, you know, all through high school, I was like, okay, learn the information from the test, take the test, next thing. Learn the information from the test, take the test. Okay, final, I have to relearn everything because I didn't commit anything to memory.
Yeah.
I just did it for the test. Because I didn't care. You know, it's so easy not to care because everybody has to go to school. Everybody has to do this. All I'm trying to do is get an A. You know what I mean? So, okay, I got the A, I'm done.
Yeah.
Whatever.
Yeah. And I think it's like a systemic issue with how we teach children in this country. Well, I was like a goody two-shoes growing up.
Oh, me too.
And I never cheated, and I vividly remember, oh my god, I remember this so deeply. Freshman year of high school, I was in honors biology with this woman named Mrs. Shubik. I hated her class because she didn't know anything, like at all. And at this point, I was not interested in science. I think I wanted to be a lawyer. I was like super into like philosophy, which I still am into philosophy, but anyways. And she didn't know anything. And you could ask her a question like, hey, Miss Shubik, what is like DNA replication? And she'd be like, oh, just Google it. I don't know that. Just Google it. And it was like, what the hell, dude? And nobody knew anything in the class. And everyone just found, you know, this was 2018. This was before AI. I know. Crazy.
Thank God.
So we cheated using Quizlet and Chegg and not ChatGPT. And
the good old-fashioned way.
The good old-fashioned way. We actually put some
We had to use our brains in order to cheat.
We had to memorize a Quizlet, you know. And the only way people were getting A's in her class was by looking up the Quizlet that had verbatim her entire tests and quizzes. First semester, I was like, that's stupid. I'm not going to do that. And then I got a C in the class, and I was proud of that C because I was like, dude, hey, at least I didn't cheat. And then second semester, I was like, but I just wanted A, like I just wanted A in the class, and I cheated, and I used Quizlet, and I didn't learn a single thing. I just memorized Quizlets, and then just spat them out on the test, and I got an A. And I felt so guilty about it that I cried myself to sleep for several nights and days because I was really sad. And I was just a goody two-shoes because for the rest of high school, I learned everything back to back, cover to cover. I highlighted every single word in that textbook. I didn't forget a single thing. And I do feel like a lot of it is so committed to memory. I mean, my hippocampus, like, might be cooked, low-key, because I just don't, like, sometimes I just forget everything, but, like, I do remember a large chunk of what I have learned, but I feel like in college it's so much harder to do that, because the information is so much more dense.
It's so much.
It's harder qualitatively and quantitatively.
Yeah.
And it's like, maybe I'll have, like, one class I, like, really dedicate all my time to, but then I'm, like, one class where I'm like, I'll just gonna be in the class, like, whatever, it'll be fine. But it's, like, it's so much more difficult. But I think it should be that way. I think it should be that way, and you should care. But I don't know. I just really have beef with people who use AI for everything, and it just makes me
I do too. But on this note, I took this class, and you did not have to study. If you wrote anything on the test that was even remotely close to the answer that this professor wanted...
Even in a different language.
Is this confirmed?
Yes. Okay.
He would give you credit for it.
Yeah.
However, I retained so much of that knowledge.
Really?
Because I would listen, he was so passionate about what he was saying. I would sit there and I would listen to him, and I was a little bit worried about the test, so I was like writing all this stuff down that he was saying, and I'm like, man, he's kind of just babbling, but like, he knows what he's talking about. He cares so much about what he is talking about right now that I left with an understanding, not a good memory of all of the things that we were talking about, but an understanding of the system, of the, the smallest part to the whole, and then the larger, and how it affects the world.
Yes.
And like, it was such an interesting experience, because I was like, I kind of walked out like, man, I didn't learn anything from that class because I barely studied and I got an A. But then I started kind of talking about it, and I'm like, man, I retained a lot of this, and a lot of this really stuck with me because he cared, and therefore I cared. So it was like, kind of an eye-opening thing. But like, if I didn't have the time, and I was so busy that I was just like, I'm not sitting through his class, I don't have time to listen to him, I'm going to do something else in class, which I could have done, and I have done in other classes. Sorry, but like, and I was just able to kind of listen to him talk and take it in, and kind of internalize it, and that was big, that was big for me.
Did you take it fall 2024?
Yeah.
Yeah, so I was in the class.
We were in the class together. No, we didn't. Yeah.
And I remember I also did not study for the class, also got an A in the class, and I would just, like, the first exam, I remember I was like, I think I did kind of bad on that.
Yeah.
I got like a C or a D. I tried the grade, I got like a 94.
Yeah.
It's like, oh, so he doesn't actually grade the words.
Yeah.
But I kind of regret that I didn't really, like, listen, because okay, guys, sorry, full disclosure,
Pause.
I stopped coming to class after midterms because one of my friends started skipping, and I was like, you know what, Queen, like, I'm gonna start, and she's the one who's doing her PhD at Purdue right now, and so she started skipping class, so I started skipping class too, but it was like, I do remember what you mean about how he was an incredibly engaging lecturer, and he was incredibly passionate about the content that he presented, and he does research on this stuff still, and you can tell he's very, very passionate about it. And I had a similar experience with Org 1 with Kevin.
Yeah.
Full disclaimer, I did not get an A in that class.
Oh, neither did I.
Got like an 82.
I got a B, yeah.
I loved coming to class because his pedagogy is very direct, and he knows what he's talking about. I'm being so serious, he could teach organic chemistry to a preschooler and they would understand it fully. And to this day, I still retain a lot of that knowledge. Yeah. Organic chemistry is, like, literally at the basis of everything.
Yeah, it is. Further, it's beautiful. Like, really,
but
yeah.
It's so beautiful, and, like, and you have to, and, like, not only was it beautiful, but I retain, basic things like chiral centers.
Yeah.
Like, chiral centers are really important,
yeah.
And just, like, understanding the behavior of molecules. And even understanding, like, that's a hydroxyl group, that's an amine group, like, simple things like that, and, like, it opens up the rest, because that is, like, I feel like, the basis of a lot of physiology. A lot of medications, it's literally, oh my god, what way does this molecule spin when it refracts light, or, whatever.
Yeah.
And it's, like, that is the basis of how a lot of meds work. Like, what's that example they always use talking about, like, there's an example of a morning sickness drug.
Yes.
Okay.
Yes.
So basically, in organic chemistry, the way at the core of a molecule, there's a carbon molecule, and that carbon molecule can only form 4 different bonds. And in chiral molecules, that carbon molecule is bonded to 4 different groups. If it depends, so those chiral carbons reflect light. and they spin. And the direction in which they spin is determined by the amount of protons in the groups of the molecules that they're bonded to. So I think, what is it? It's like clockwise is R, counterclockwise is S, or whatever.
Yes, because the R goes like that.
R is clockwise.
Yeah, R is clockwise.
So basically, there was this drug, and
It was phthalimide.
Phthalimide,
Yeah.
yes. And I think the R enantiomer was...
No, thalidomide? Thalidomide? Distaval?
Thalidomide.
Thalidomide?
And
yeah.
the R enantiomer...
Oh, because that's the actual structure.
So the R enantiomer, right? The R enantiomer is like a legit morning sickness drug.
Yeah.
And then the S enantiomer causes birth defects.
And it's like actually toxic. Yeah.
Incredibly toxic to the fetus. And they didn't really know that the enantiomers had different effects, so they just produced the drug in full enantiomers, both enantiomers. And because I think it's a racemic mixture, or it was a racemic. Racemic mixture is 50-50. I think it was a racemic mixture. Both of the enantiomers were in the pill. People started taking it, and they didn't have any morning sickness. People started having birth defects.
Well, it was like 50-50. You know, like it was like you might be getting a pill, some of the pills that are only, S or only R, or a mix of both. But it's so funny to me that like our class examples were completely different. Where yours was so hard or the one that the org one was so hard that we had to commit everything to memory. Yeah. And he was an engaging speaker and he was good at his job, but it was so hard that we had to commit everything to memory, and that's why I remembered stuff. And then mine was like, it was so easy that I was able to kind of relax and like take things in a way that like made sense to me because I didn't have to memorize everything. Yeah. You know what I mean? And like I agree with what you're saying about Kevin. Like I think that a lot of that did stick with me, but it just like not in the same way. Yeah, that's really interesting. Yeah.
Wait, really, that's so interesting because I think about this all the time. Like I really do think about organic chemistry all the time because like
I do not.
I think it's so cool because like it is like literally the basis of like everything. Yeah. It is like how that is the basis of how a medication works. Yeah. And not in all cases, but in a lot of cases. And okay, I don't want to talk about biochemistry. Guys, I have beef with biochemistry. Let's not talk about biochemistry.
But no, I agree. I think organic chemistry is like, I liked it way more than inorganic because I could apply it to things that I saw all the time.
I hated Gen Chem too.
Gen Chem is awful.
Gen Chem is like, listen, like it wasn't hard. Like I got A's in both because I was like, the class was curved, but it was like, I don't remember. Isn't that funny? I got B's in Org 1 and 2, and I remember things from organic chemistry. It's so relevant. I don't remember anything from Gen Chem, and I got A's in both of those classes. I don't remember. You ask me to do an ice table, I will shave my head on the spot. I'm not even kidding. I think it's dumb. Sorry, I don't think it's dumb. I can't do it. I hate it.
I think that is, I think that's the difference in caring. You know what I mean? Like, sorry. Yeah, I think that, and another thing, but like getting all A's and understanding is different. Yeah. They are different things. Yes. And I think that is like, that it's so hard, applying to like grad schools or like even medical school and being like, hey, I got B's, but I promise that I know the information.
Promise. Yeah. Yeah. And they're not going to believe you.
So maybe they are. In the interview, maybe, but like, I feel like, at least in my head, all my classmates have a 4.0. Everyone who's competing against me has a 4.0, and they remember everything, and they're doing a million different extracurriculars, and they're volunteering 20 million hours a week. You know what I mean? And they're perfect, and they're ranked attractive, the most attractive on that scale for the recto-vaginal endometriosis.
Even though they're men.
Even though they're men and women. Everyone who I'm competing with. But, and that's just not the case, but and also like getting all A's is amazing. Like that is very impressive. Yeah. But I think that a lot of our education is not built for everyone. Yes. It's not built for everyone. It is hard to be the kind of student that a university wants you to be, and it's just so I think that anyone can succeed, but I think some people are just more built for it than others. And that seems so unfair.
Yes, and I do actually want to make some non-redacted comments about this. I do think, like, it is so respectable and honorable to want a 4.0 and want to be perfect in school. Like, yes, you go, people. Like,
strive.
Good for you. Strive. Try your best, work hard, put your effort in. But also, I think the quality, like, your life outside of school is also very important. You are a person. Hello, guys, pick up the phone. It's ringing. You're a person. I don't know if you noticed that yet, but, like, you are. And, like, you can have a personality and have interests and dislikes and likes and hate people or hate things or be really obsessed with Roller Coaster Tycoon like I was when I was 12. Or, like, you know, there's a wide variety of things. And, like, putting yourself in this little box, I'm in my box, it's like, I've seen that Instagram reel of, like, that woman was like, oh, this is really funny. She was like, oh, I'm in my box, something bad can happen to me here. Nothing good will ever happen to you either. And I was like, oh my god, she's right.
Dude, you know, you're so right. And, like, I think doing things because you enjoy them and not just because they look good on a resume. Mm-hmm. Be in a club that you like, even if you're not going to be president of it.
Yeah. Dude,
do things that you enjoy because it's fun and it will make you not want to die.
And in that similar vein, do things that you suck at, even if you enjoy them. If you don't enjoy something but you're really good at it, quit. Walk out the door. Stop it. You should have stopped that yesterday. You should be doing things that you are absolutely deplorable at.
Yeah.
The first time that I cooked orzo, I burnt it so bad that I set off the fire alarm, okay? And now I can cook orzo and it tastes amazing.
And you can cook all kinds of shit. It's all so good.
And it's also good.
Yeah.
And I wasn't like that a year ago. It took me a little bit of time.
Yeah.
I used to suck. And now I don't suck anymore.
All right, thank you for coming to our advice segment.
Yeah.
Back to physiology.
Back to physiology.
Okay.
Sorry, we really were a little off there. Okay.
It's okay. I might just leave it in. Like, all of that. Or, I'll pick and choose based on what else we get. But overall, I think so many students are so conditioned to want academic perfection and not academic curiosity.
Yes.
And I think that, at least in my opinion, and if I was a professor, if I was an employer, I would rather someone who cares and wants to learn for the sake of learning. But it is not easy to want to learn. Learning is so hard. But when you do want to learn, it makes learning easy. And maybe I was just like, that was like a nothing sentence.
It's okay.
But that's how I feel. And
that's the only justifier that you need.
Yeah.
Yeah.
I think that learning for the sake of learning is one of the most beautiful things, and that's why we've come so far as a species. You know, we've done so many things and found out so many things just because someone wondered and was curious. And we have and there are still people doing that, but I think that there is so much research happening because my professor told me to do it, or my employer told me to do it, or
I have to do it to get into med school.
I have to do it to get into med school, or like, this is easy and this is fine, I guess. I could do this is fine, this works. And it's also hard to formulate questions that haven't been asked yet.
It is.
You know, but that's why learning for the sake of learning and being curious and asking questions all the time, and not just when you're like, oh, I need to think of a question for a research project.
Yes.
You know, and like asking questions and being curious about everything, you know, and then it's not an easy task, but it is so important.
Yeah. And that is like, that is what drives progress. You ever sitting there and you're eating like cream cheese and you're like, wow, I love cream cheese. That was us this morning.
We love cream cheese.
Do you ever think about how cream cheese was discovered? I don't know. Probably someone fermented something or added vinegar to milk, or, you know.
Something like that.
Something like that. I don't know.
Yeah.
And that is how like, it's just like, I think having hobbies that drive you to ask questions or be curious or experiment are really...
They're vital.
They're vital. Now, drive you to ask questions, even on like a small scale. Like, I really, really love to cook. And I love it, well, A, because I'm a human being who needs food for sustenance. So not only is it a hobby, I'm fulfilling a need. And two, it's like fun. I've never followed a recipe in my life besides this morning with the crepes. Because I don't believe in recipes. You know how I make food? The other day I was like, I really want black bean burritos. I don't have any kind of jalapenos. I put on the pan on the stove, I put some olive oil, turn it on medium heat, I saute onion, and then I add garlic later. And then I was like, damn, I have some peppers going bad in the fridge. I'm like, put some pepper. Let's see what happens when I put some peppers in the black bean burrito. Put some peppers in there, put some seasoning, put some black beans, and it was amazing. And you get to that extent by just experiment to understand. And then
scientific method,
and like start on a small scale, but like you should be curious, bro. When in org lab when we made like polymers, never mind.
That was so fun.
Now, and I'm using a pad. I'm like,
yeah.
Oh my God, we literally made a menstrual pad in organic chemistry lab.
We did. Wasn't that like, so fun?
Isn't that so cool?
Yeah.
And if you have children or you interact with babies, it's the same
in diapers, yeah.
You know, and it's like the basis of everything. It is quite literally the basis of everything.
And that's how we're drawing connections. Org lab, boom pad.
Boom pad?
Boom pad.
Oh, yes. Yes!
Yeah.
And you know what? I had that slime in my backpack for a year after the fact. I threw it out like a couple months ago.
I liked playing with it one time, and then I put way too much food dye in it though, so my hands were so blue.
Oh gosh.
But it was worth it, and we made it. It was slime, no glue, yes, borax. You know.
It was so much fun.
It was so much fun, and like there is beauty and joy and entertainment in science, and there is beauty in physiology and anatomy and just the human body. It is like. It is so amazing the way it all works together, and it is so inspiring, especially in a culture. This is something I don't think I've gotten into yet, but in a culture where we are so often taught to hate our bodies, to hate our face, to hate the way we're built, and it's like, no, think about it.
Yeah.
Think about it. Like, it is so beautiful, and the way it works is amazing, and it is so complex, and it is so hard to learn. And it is so complex and it all works. Well, it should work, you know, and when it does work, it's awesome.
And really quickly, I just want to add to that, like, I think it is crazy that, like, the dialectics of it all, of, like, it is simultaneously really hard to kill a human being, but also, if one thing is out of balance, it's so easy to kill somebody. It's like, it's crazy. The balance is so delicate and it's so intricate. Our bodies are so intricate.
Yeah.
Wait, okay, I have a question.
Yes, ma'am.
Do you have, like, a favorite thing you learned in anatomy lab or anything in physiology that you thought was really cool that you want to talk about? Because I have some ideas.
I mean, I think I'm just going to let you take the floor with this one, and then I'll just add on as you go.
Okay, yeah, so for me, I really liked learning about anything neuroscience in anatomy lab. I love talking about the brain. I love the brain. When I held a human brain in my hands for the first time, and of course it wasn't living, this is a cadaver brain, but I like started tearing up. Because I was like, oh my God, this is in every single one of us. And if you've never seen a cadaver, you've never seen a human brain, you have no desire to, that's totally cool, but it is, FYI, pretty much identical to every single, like, diagram you can find on the internet. It's like the neon, like each lobe is like a different neon color, and like,
and it's just like that in real life.
And it basically is like that in real life. I mean, it's not neon, but structurally the integrity is exactly the same. And I think just like the cranial nerves, listen, we have 12 cranial nerves. 2 of them are, I think, like not, it's like 2, I was reading about this in the textbook, hold on, let me read this up really quick. Which 2 cranial nerves are, what?
What is the question that you're asking?
They're like not attached to the brainstem. Okay. So I thought this was so cool, and I actually go through my cranial nerves in the shower every morning, and I'm being dead serious about this because I don't want to lose that information. So there's a mnemonic we use for cranial nerves, O, to touch and feel very green vegetables, aha. So olfactory, optic, oculomotor, trochlear or trigeminal, let's just go with trochlear, to touch, trigeminal, and abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, hypoglossal. And like, as
that was actually amazing. We have not touched this in so long. Like, I am so proud of you right now.
Dude, thank you. And I'm telling you, I go through it in the shower every single morning.
I need to start doing that.
Because I think it's so valuable. And I can see exactly where they are on the brain.
Yeah.
Do I remember what they do? No. And I should.
Except for the trigeminal and trochlear.
I don't even know where those
yeah.
I don't even remember.
It's tiny trochlear. No, there's a tiny trigeminal. No, it's trochlear.
It's trochlear.
Yeah, so like that's the teeny tiny itty bitty one.
It's like a.
She's so cute.
She's so tiny, and then Vegas is much bigger.
Yeah.
And then because
Vegas is back back in the.
Yeah.
I don't know why I was going like that, but it was like
Or it's on the brain, or accessory and hypoglossal are like on the
brain.
Yeah. The medulla.
Or somewhere on the like hind.
Somewhere in the brainstem. Yeah, and it's just like, I think maybe this might be controversial, but I think this information should be accessible to everybody. And I think my most controversial.
That should not be controversial. It should. All information should be accessible.
I think
every scientific piece of information we know should be accessible to everyone.
Not behind a paywall. Not you have to go to school. Not you gotta tell the code to the magic troll that'll unlock the key in the bridge. Like, it should just be accessible straight up. I think the world would be a lot better place if we all took, like, math up to Calc 1, science up to anatomy with Cadaver Lab, basic psych classes, and basic philosophy classes, and, like, maybe, like, basic music theory.
Yeah.
I don't know. I'm forgetting.
So you're just saying, like, all education should be accessible to everyone.
Yes.
Yeah.
And I think, like, the value, and I know you agree with me on this, like, the value that we've gotten from Cadaver Lab is immeasurable.
Yeah.
To know what your body looks like and to know what it does is, like, insane. That's something that everybody should know.
Yeah.
I understand myself better since taking that class.
Yeah.
And I'm glad that I did.
Yes, I agree. And I think that, like, I feel like I've started all my sentences with "I think that," like, and I need to like I need to stop doing that. But now, after seeing kind of like how we are in death, like, and this is, I might get a little too existential with this, but like in my own life, like, I think, all life is sacred. I think all death is sacred as well. I think it is we cannot exist without it. And that's something that we talked about in cell bio too, whereas like a cell is alive and it has to die. Nothing can live without death. Mm-hmm. You know what I mean? And like, and I think that is like one of the most amazing things, and seeing kind of like the up close and personal with death is important. It makes you appreciate life, but it made me fear death a little bit less.
Yes.
Because you see it, it's like, this isn't some like, external thing that I could never imagine and I could never think of it and I don't want to think about it, blah, blah, blah. Like, kind of giving yourself the opportunity to experience what death looks like. Yeah. And I don't know if this is, relevant, but like, it's just like, it is kind of beautiful in a way, like, and life is amazing and life is so important, and that's why we do everything, because we're alive, duh. But like the people who donate so that we can learn, the people who are willing to let us see beyond the flesh, like, it is so important and it's so amazing, and it's so like, it makes you appreciate every single person who is willing to donate their bodies to science.
Yes. Yeah, it really does.
Yeah. It
really, really does. And I know, I think about that lab a lot, actually. It was just so valuable. It was so valuable. Also, I didn't know that ovaries were so tiny.
Right?
I thought they were the size of like your like the nail bed of
They're
your ring
so
finger.
small.
They're so small.
Yeah.
And also, I didn't know this, but the fallopian tubes are actually not attached to the uterus, like, at all. It's just like the round ligament or the broad ligament of the uterus that attaches it.
Yeah.
I didn't know that. They have like fimbriae to connect to the ovary.
Right.
But still, they're just kind of like floating. I don't know. And I don't know if it was like the round ligament or the broad ligament or whatever ligament of the uterus that connects the uterus to the ovary. But the fallopian tube is merely a conduit for the egg, but not for connectivity.
Right.
Which I thought was like really. Is that just hit the window? Yeah. Anyways.
No, they're just bugs. I don't know. I think like it's so. And we learn a lot about like female anatomy, but it was interesting that we did all learn it all on the models.
Yeah. Yeah.
That was interesting to me.
I agree. And I remember thinking that. I didn't really want to say anything about it.
Yeah.
Like, oh, I'm just weird.
It's like kind of not our place either, you know.
But I feel, honestly, no, I think it is our place as learners.
You know, you're right. You're right.
Yeah.
Yeah.
To want to receive the experience.
Yeah.
You know, but I mean, I didn't think that a lot of, like, I didn't know. I thought that was kind of, I don't want to say common sense, but I feel like everybody knows what female anatomy is. Or at least and then
they should,
and then you learn that that's actually not the case.
Yeah,
and that's okay. You know, it's okay to not know. It's a great thing.
It's a learning experience.
Learn and want to learn, but I do think that it should be taught on a cadaver, or at least like Tina. Sorry, can I elaborate who's Tina?
Yeah,
Okay, so Tina. Okay, so Jaden, our TA, was like.
I love you, Jaden.
I love you, Jaden, if you're seeing this. I think I asked a question about something, and she goes, have you met Tina? And I was like, no, who's Tina? And she goes, oh, wait. And she, like, runs to this closet, and she picks out a bucket, pops open the bucket, and it's a uterus, ovaries, and vulva. And I think, like, bladder and anus. And she goes, this is Tina. And I was like,
got it. The mic picked that up so well, guaranteed.
Shout out Tina, and Tina had, I think she had polycystic ovarian syndrome, I believe. But, like, thank you for letting us learn, Tina.
Yeah, really appreciate you.
Yeah.
Yeah, and I think that was, you know, that clearly stuck out in your mind and what seemed like a good learning opportunity.
Yeah.
Yeah, and, like, learning on the model, very helpful. Learning what it looks like, and that is something else you learn, like, in the anatomy lab is, like, how different every body is.
Just gonna say this, you're on, like, the same wavelength as I am. Sorry. You're on the same wavelength as I am. Go on.
No, but I think that it was insane to be like, okay, well, this person just, like, doesn't have this connecting here, so we're gonna look it on this other person, and I'd be like, why? Like, why? Are they dead? Like, is this why they died? And you're like, no, they just live like that their whole lives, and they're just, like, don't have this specific ligament or this specific whatever, and it's like, how do you...
Like,
okay.
The two primary examples I can think of this was on the female cadaver closest to the front of the room. She had, so there's the hemiazygous vein and the azygous vein. I forget which side they're supposed to be on, but they're veins in, like, the thoracic cavity. And when we were learning them on this cadaver, they were like, okay, that's the azygous vein. And you're like, okay, that's the azygous vein. And then on the practical, it was tagged on a completely different cadaver, and I think, like, more than half the class got it wrong. Because it didn't even look anything remotely similar to how we learned it. And it's just such a variation. And then, like, on Brad, I think it's the cephalic.
Also, these names are not their real names. Real. Like, it was, like, nicknames given to them so that we could, you know, refer to them in a way, but, like, that's not their real names.
Yes.
Yeah. Just for disclaimer.
Compliance.
Yeah.
And I think it's, like, the either cephalic or brachiocephalic vein, and it's just supposed to be, like, I think one big fat vein, not really big, but just one vein in your upper arm. I think it was brachiocephalic, and he had two, and we were going over it with one of the teams.
Oh my gosh.
Yeah, and I was like, what's this? And she was like, I don't know. And then we had to, like, think about it. She's like, okay, wait, hold on. I think that's just, like, a variation because you can see it split, and then it connects
like, it's,
back
like, split in a way that it wasn't supposed to, you know?
It wasn't supposed to split, it's just supposed to be one vein down from the shoulder to the elbow, and then it turns into, like, the, radial vein and medial.
Well, like, it's,
whatever, I'm forgetting. But, yeah, and it's, like, there's so many variations that are so cool, and it's, like, why do they occur? I don't know.
We'll get there. That's physiology.
The universe just wanted you to have a split brachiocephalic vein, and that's totally okay.
And that's, I think, what's so fascinating, like, even further, we should, you know, but I think the most amazing thing to me is, like, it is an almost perfect machine. It works this way because it has to. The cells work like that and are that way because there is no other way for them to work. And glycolysis is not the most efficient practice, but we need it to move on to something else. There's lots of systems in our body that are not as efficient as they could be, but they need to be like that to get other things done, for other things, that we need these byproducts from this specific thing so that we can do something else. And it is because of how it all works together that allows us to be breathing, thinking, moving, talking, interacting, seeing, like having all of these things that our body does constantly without us even realizing and understanding and appreciating. But it is all happening because it is such a fine-tuned machine. And that's why when one thing is off, it can break down your whole life.
Yes, and it's like, it is, like you were saying, it is incredibly intertwined, it is such a delicate balance. And like you were saying, like the products of one, like, cycle help, the other cycle. And it's like, if any one of those things are out of balance, a whole cascade of things can go wrong instantly. And so it's like, I mean, yeah, if you don't eat a vegetable for a month, you're probably gonna be okay. But like,
average college student experience.
Right? But like, things are gonna be happening like metabolically. And
that you don't even know about.
You don't even know about. And also, it's like, our bodies have so many like backup plans. Like, so, listen, I have beef with how our entire lives, especially I think as women, carbs are demonized. And everyone's like, don't eat bread, it's gonna kill you, you're gonna, blah, blah. And it's like, okay, yeah, if you're diabetic, please be careful. Please don't willy-nilly eat carbs like that. But like, I mean, in a sense of like, glucose is your body's primary form of energy. It is like the quickest form of energy that we have.
Yeah.
If you eat a granola bar, or an apple, or a slice of bread, or whatever, those are all quick carbs that your body's gonna utilize immediately. And then, what is it, fats or long-term energy storage? And that's the thing is, and like, maybe I'm just crazy, but like, people obviously demonize, I mean, there's a lot of like fat phobia.
Trans fats,
Yeah, and then it's like, but it's, girl, that's just like glycogen and like adipose tissue.
And it's everything in moderation. You need it all. You need so many different things in your diet that compose health that you need, but you need fats, you need carbs, you need sugars, you need all these things that are scary.
Yeah.
And you need calories to live.
Yes.
And it's insane to me how we've taken it from like, oh yeah, you need fat, just don't drink a gallon of oil every day. Yeah. And then it's become like, if you have any trans fats, you're gonna die tomorrow of cardiac arrest. Like, how does that, like, I just don't understand the mental connection there.
Yeah, and it's like, I mean, like, maybe don't eat like an entire frosted cake from like Walmart every day for dinner.
But once in a while is
But once in a while, you are gonna be fine. And like, and I also feel like people love to demonize, specifically trans fats, yes. And the crazy thing is, if you stop a random person on the street and they're like, how do you feel about trans fats? And they're like, probably bad, right?
Yeah.
Well, all the distinction is between a cis fat and a trans fat are the way the side groups are pointing. If you have a carbon, hold on, do I have a pencil? I got my handy dandy little expo marker. We're gonna do a little demonstration of a trans fat versus cis fat. Okay, this is very like not crazy, okay? You have a carbon, they're double bonded, okay, and then you got like some other whatever R group, some other whatever R group. This is a trans fat because the R groups point in different directions. That is it. That is the only difference. The distinction is how your body metabolizes it. It's harder for your body to metabolize it, and it accumulates in your arteries, whatever. A cis fat is when one of these R groups, let's change one of these R groups to make it point in the same direction. That now, my friends, is a cis fat. The R groups point in the same direction. And that is the, like, literally only difference. And that's the only, like, structural difference. Of course, the real harm is how your body, like, metabolizes it. And of course, we can get into, like, saturated fats and unsaturated fats. And the only difference for those, saturated fats, all the carbon-carbon bonds are single bonds, because all the carbons are fully saturated with hydrogen bonds. Unsaturated fats, all the carbons are not fully saturated with hydrogen bonds, so some of them are double bonded. That's the only difference. That's literally it. And I think, what is it, the fact that, like, double bonds are easier to break down because they have more energy, right? Because they can attack, like, it's like a nucleophile. Isn't a double bond a nucleophile? I don't know.
I don't remember.
It doesn't matter.
I didn't retain as much from org 2 and org 1 as Kristi did, but I should though.
No, but that's okay. But no, basically the point is, like, don't let people scare you.
No, but
Because
I mean that's the
technically it's
thing.
not that big of a
That
difference.
and that's the gag is that like physiology and anatomy and stuff. People love to talk about it and not know what they're talking about.
Yeah.
And that's why learning it like we are now, it is inspiring us to do so much with it, is because there's so much misinformation. We've grown up thinking things that aren't true, grown up not knowing things, and learning how things work and how they actually truly are in the body is insurmountable. Like, it's amazing. It's amazing to actually learn and understand what's happening.
Yeah. Yes, and it's like I've been curious about this stuff. Dude, like for my whole life, I remember I took AP Psych sophomore year of high school, and I really, really enjoyed the neuroscience.
Yeah, the brain
chapter,
stuff.
The brain stuff, and I was like, I want to know more,
Yeah.
but I don't have the access to the
means.
information, the means, and now I'm like, oh my god, I literally held a human brain in my hands. How incredibly rare and unique is that?
That's amazing.
Insane. I am so grateful for that experience.
Yeah, we're so lucky to be able to do this
Yes.
and to be able to have these opportunities. But it shouldn't be that way.
Yeah.
Everyone should have that opportunity, you know?
Yeah. If you so desire, you should have access to that.
Right. Yeah, if you want to.
Yes.
You don't have to hold the brain in your hands if you don't want to, but you should want to. Anyway. Yeah. And encourage others to learn. And if you have a topic you want to know more about, put it in our comment section. We'll
Yes.
research it and have an episode about it maybe one day.
And we guarantee that.
And we promise that on our lives.
Yeah. Yes.
If someone actually commented it, we would have to.
And I would. Like,
I would also. Yeah. Concluding thoughts, baby girl?
I don't know. I just think you should think critically about things, and you should be curious about your own body and what it does for you, and always use your critical thinking skills. Just be curious and be open to other perspectives, and try your best, but have an interest in things. Okay.
And most of all, stay freaky. Okay.
Okay.
Hi, well.
Isn't that horrifying? Maybe, you guys, don't go to Italy. Sorry, I don't mean to contribute to, like, nationwide hopelessness.
Okay.
Well,
I mean, listen. All right.
Peanut
I'm gonna say.
allergy. Sorry, I'm still on the list. Peanut allergies is on here.
Mind.
Beth Shubik, I hate you. Anyways.
Kristi, I will hate you. I've never heard of that.
I think I just, and also,
Yeah.
I'm a big experimenter. Girl, if you want to selectively inhibit my serotonin reuptake, girl, go ahead. My synaptic cleft, I'm going to open the key to you. Go right in there and make some changes because I'm ready.
And make a
But I
change. I'm starting with my serotonin inhibitors. That's my Man in the Mirror cover.
Dude,
but
yeah.
serotonin inhibitors.
And